nurse practitioners here at PCI. We have 2 other nurse practitioners along with a big team that will be helping you through this journey. I want to tell you first a little bit about your team. So you're going to have, of course, your physician. You're going to be seeing nurse practitioners. We have a registered nurse who's a patient care facilitator that's going to be working with you, along with your chemo nurse. It's a very nice thing that we do here. We have primary nursing. So the nurse that gives you your chemo should be the same nurse for the most part each time that you come in for treatment. In addition to that, we like to really care for mind, body, and spirit. So we have some ancillary services that are going to be helping with your care as well. We have Greg, who's our music therapist. We have Julie Kilburn, who is our social worker. We have Chrissy, who does massage therapy. We also have pet therapy. So we try to work together with you as a team to help support your care. Also, a lot of patients have questions about nutritional concerns during treatment, and we have a nutritionist named Lynn Groger who is wonderful as well. I'd like to take this opportunity today to give you some concrete, easy to follow information to help you know what you need to do to best take care of yourself and your body as you go through this journey with us. So the first thing I want to tell you about chemotherapy is the goal of chemo, of course, is to attack the cancer cells. The cancer cells in your body are, by definition, fast-growing cells. So when we attack these fast-growing cells, we do have the downside that we're going to be attacking fast-growing cells in your body that are healthy as well. So I want to talk to you a little bit about what that means in terms of your health and how that affects your body and side effects. So when you think about fast-growing cells, the first thing I'm going to talk to you about is your blood. In the large bones of your body, you have a liquid organ there that's bone marrow, and it's a factory. It makes all your blood corpuscles. It makes your white blood cells, your red blood cells, and your platelets. Starting with your white blood cells. Your white blood cells are in charge of your immune system. They're the soldiers of your immune system that surveil your body. They look for problems, bacteria and viruses, and when they see those invade your body, the white blood cells attack those things. They attack the bad guys that enter your body. So we know that chemo is going to affect those white blood cells. They're fast-growing cells and they're going to be affected by chemo. So the question is, what do we do to help protect you from infection? And the answer to that is common sense things. We want you to be washing your hands as often as you can. We want you to avoid people that you know are sick. You may even want to be careful about the foods that you eat. So fresh fruits and vegetables sometimes can be a source of infection. If a fruit is in a peel, like a banana or an orange, it's fine. If you wash your fruits and vegetables very well, that is fine. If it's cooked, it's fine. But you might want to be careful about getting, say, a garden salad from a restaurant setting. Also in terms of white blood cells. If you notice that you have a temperature, our magic number that we start worrying about is a temperature greater than 100.5. If you get a temperature greater than 100.5, whether it be the weekend or during business hours, we want you to give us a call so we can help you to navigate that. We're going to treat you more aggressively than we would a person who has no problems with their immune system. Okay, so the next blood corpuscle that I'd like to talk to you about are your red blood cells. These are the cells that go around your body. They carry oxygen to all the organs in your body. And we know for a fact that those red blood cells are going to be affected by chemotherapy. Now, we know that we're going to be causing some anemia. This is not a nutritional anemia. You can't eat your way out of this. Eating extra raisin bran or liver, things like that, is not going to help this type of anemia. What we will do for you, however, is we will monitor your hemoglobin as you come in for treatment. Normal for a woman is around 12. Normal for a man is around 13. If your hemoglobin drops down to 7 or below, at that point we would offer you a blood transfusion. Now don't be anxious about that. Not everyone drops that low, but it's just something that I want you to be aware of, something that could happen. The most common thing that happens from this anemia is that people tend to be tired. That's the most common complaint that people have about cancer, about having cancer, and also being under treatment in general. It's that feeling of fatigue. So if you can listen to your body, if you need a rest, take it. If you need to back off of your normal duties that you do in the house and get a little extra help, this would be a good time to take advantage of the help in your community. The third blood corpuscle is my favorite. It's the platelets. Platelets are amazing. They stick together in your body like Velcro, and they help to keep you from spontaneously bleeding. So the fact that we have all these platelets sticking together in your body is what keeps you from spontaneously bleeding when you brush your teeth, from your nose, blood in the stool, blood in the urine. We don't usually see these things because we have the platelets that are protecting us. Now, platelets are amazing. There's a wide range of the numbers of platelets that you need in your body for them to work, and it can actually drop quite low before you have a problem. So a normal platelet count is somewhere around 130,000. Most people aren't going to have any trouble with bleeding unless it drops down less than 50,000 or even 10,000. That being said, even though most people won't have a big problem in this regard, if you do notice that you're having any unusual bleeding, like a nosebleed, blood in the stool, blood in the urine, give us a call so that we can decide what to do. It may be as simple as having you come into the office, we draw your blood and check and see what your CBC is. It may be as simple as that, but just let us know, stay in communication with us. Now, back to the idea that the chemo is affecting your fast-growing cells. Let's think also in your body, what other cells, other than the cells in your blood, would be fast-growing? The first thing that comes to mind is hair. Hair is definitely a fast-growing cell, and for most chemotherapy regimens, we have thinning, if not complete hair loss. And this is something that you want to emotionally prepare yourself for. Also, you can have trouble with the mouth. The cells on the inside of your mouth are fast-growing, and so you can have side effects such as dry mouth. You could have mouth sores. You could have thrush, which is like a white coating on your tongue. If you have any of those problems with your mouth, we want you to give us a call because there's things that we can give you to help with those types of symptoms. Another thing that we recommend in terms of your mouth is using a mouthwash such as Biotine. Biotine does not have alcohol in it like Listerine does, and that helps to prevent that dry mouth. Biotine also makes a spray that's very good for a dry mouth that patients have told me that they like. Another thing that patients have told me that they like to help get metallic taste out of their mouth and to help with nausea and things like that is ginger snaps. They're very helpful. People, those little thin cookies with the ginger in it tend to help patients as well. Now, something to be aware of is that we do not want you to go to the dentist during chemotherapy. If there is a need to go to the dentist during chemotherapy, we want you to let us know, because when they even do a gentle cleaning in your mouth at the dentist office, that puts you at high risk for infection. So that's something that you're going to want to avoid while you're doing chemo treatment, which makes it even more important that you're keeping your mouth really clean and that you're doing really good mouth care. Other cells in your body that are particularly fast growing are the cells of your skin. It's really good to use a good moisturizer on your skin to help with the dry skin problem. Some patients have trouble with nausea and vomiting. Some patients have trouble with diarrhea and constipation. Now let's talk about nausea and vomiting for a minute. Your nurse will be sending in some medications to assist you with your chemo regimen. And depending on what your regimen is and how strong it is in terms of causing nausea, we'll be sending in a different regimen of pre-medications to help you with this nausea. Now, everyone will be getting a prescription for two nausea medicines, one called Zofran and the other called Compazine. Those are both to be taken if needed for nausea. Now, oftentimes we'll be giving you other nausea medicines in with your chemotherapy, some that even last for up to 2 days in your system. Plus, a lot of patients also will be given a prescription for dexamethasone, a steroid that also prevents nausea. So it's not unusual for patients to not really even have much in the way of nausea. But if you do, we want you to use these medicines that we've sent to you, Zofran and Compazine. Zofran can cause a little bit of constipation. Compazine can cause a little bit of drowsiness, so you may want to keep that in mind as well. I wouldn't drive a car or use heavy machinery when you take Compazine. But if you're tired and you need a nausea medicine, Compazine might be a way to get a little extra rest. Zofran, if you're having a little bit in the way of loose stools, could actually help with that because it tends to be constipating. Some people find that one works better than the other. Some people find that alternating them is helpful. It's really up to you. We have to kind of try different things during your treatment and see what's going to work best for you in terms of your nausea. It's something that we prioritize because we really want you to be as comfortable as possible as you go through treatment. And if you find that the drugs that we're giving you to help you with your nausea are not doing the trick, we want to know that. We want you to stay hydrated if possible. And if you're having a hard time holding down fluids or food because of this treatment, we need to know that as well, because we may even bring you in, check your electrolytes, and make sure that maybe you might need some extra fluids, IV hydration. Anything that we can do here at the office to keep you from having to go to the hospital is a win in our book. Now, I also mentioned that some regimens cause diarrhea and some cause constipation. The number one thing that we recommend for patients that are having loose stools is an over-the-counter medicine called Imodium. The number one thing that we recommend for patients having constipation is another over-the-counter medication, and that is called Miralax. If you have any questions about that, let us know. I wouldn't change anything to your bowel regimen at this time. I would wait until you get started with chemo and see how it affects your body. Now, another fast-growing cell that a lot of patients may not think about are the cells in the tips of your fingers and the tips of your toes. There's nerves there, and they grow at about the same rate as the hair on your head, so they're very fast-growing. This is why some chemo patients will say that they have peripheral neuropathy. A lot of people ask me, what is peripheral neuropathy? It's a feeling like pins and needles, a numbness, tingling type feeling that you can get in your fingers and toes, and the tips of your fingers. Some patients who have diabetes have already experienced this. What you should do is notice, do I have any of this now before I start chemo? And then take note as you go through your chemo treatment. Is this changing for me? Is it harder for me to button my shirt? Do I feel a little different when I try to walk on the ground? If you notice things like that, that's something that we're going to be asking you about, and we want you to be honest with us because we're going to tailor your regimen to help minimize that side effect as much as is possible, because unfortunately, peripheral neuropathy is one of those things that's not necessarily reversible. Now, that is by and large most of our side effects having to do with fast-growing cells. Another thing about chemo that makes people nervous is that it can cause an allergic reaction. A chemo reaction is what we call it. Now, you will be safe here at the chemo center. We're very trained to deal with these types of reactions, and if you do have an allergic reaction, we're going to respond to you promptly. We will give you medications to help reverse that reaction. If needed, we would even send you to the hospital for emergency care. By and large, most patients are not going to have that experience because we're very aggressive in the way that we pre-medicate you to help prevent these types of reactions. And your nurses are very well trained to notice if there's any differences in the way that you're acting or feeling during treatment. So we usually catch these things very early on, but it is something that I want you to be aware of, that allergic reaction is a risk of chemotherapy, and we will be monitoring you very closely for that. Now, another thing I wanted to talk to you today is about the Metaport. Some of you may already have your Metaport in place. Some of you may have it scheduled down the line, and some of you may not need one, but I do want to talk to you a little bit about it. So the Metaport is something that's surgically implanted right under the chest wall, usually right here. It doesn't matter which side it's on, either the right or the left. And once that surgical incision heals, you're left with just a lump under the skin that we utilize to access your vein for chemotherapy. That way we don't have to keep poking your veins in your arm, which would be more sensitive to the chemo drug and could even cause tissue damage. You do much better with a Metaport. Now, we do have to access that Metaport with a needle, and we want that to be as comfortable an experience for you as possible. So what we'd like for you to do is apply some Emla cream to that area. We'll give you a prescription for this. It's just a dollop of cream that you're going to put right over the surface of your Metaport, and then you cover that with either a large bandage or a little saran wrap. You do that about 30 minutes before you come in, 30 minutes to an hour. There's no exact science to it. By the time you come in here and your nurse accesses your Metaport, it should be nice and numb, and it'll make it easier for you to go through getting the needle in the port so you don't feel much in the way of pain. Now, bear with me. I just want to look at my notes and make sure that I remembered most everything that I wanted to tell you. Do make sure at home that you have a digital thermometer that's in good functioning order. That way, if you do feel like you might have an infection, you're able to accurately check your temperature and let us know what that actual number is. That's very helpful for us. And other than that, I think I've just about covered everything. I do want to let you know that when you do come in for chemotherapy, we're going to be giving you a PCI binder that's going to have some more detailed information in it, in addition to numbers that you can call, whether it's the weekend, nights, or during business hours, so that you can reach us at any time of the day if you have a question or concern. Thank you so much for taking the time to listen to me. And if you have any questions, please feel free to call back to the office, because we'll be happy to explain to you about this information a little further. And we wish you the very best as you go through this journey with us. Thank you so much.